Hi, I'm Dr. David Stoker, board certified plastic surgeon in Los Angeles. I'd love to share with you a great example of a tummy tuck on a 44-year-old mom. Let's check it out. You see here, she's got a lot of excess skin on the lower abdomen. She also has a lot of extra fat in the surrounding areas here. There's skin laxity and stretch marks down low, pubic laxity, and she doesn't like any of it. She's had 2 babies, and she really would appreciate if we could do something to restore her to her pre-pregnancy figure. So that's what we did. The tummy tuck is key for this surgery. We did a really large extended abdominoplasty. That means I went as far as I could go without flipping her over on the table, removing all of that excess skin and fat. We then lifted up her mons pubis area, which got rid of that prominence that in the underwear, which moms do not like, and allowed me to also tighten up the inner thigh skin simultaneously. It doesn't require an extra incision for me to do that, but it's just extra time that's well worth it in my experience for patients like this. We also performed 360-degree liposuction on her, and look at what the combined effect is. She's just a smaller person afterwards. She's so much closer to her pre-pregnancy figure. I know that it really inspired her to not only enjoy the benefits of her body from plastic surgery, but to take it to the next level through diet and exercise. One of the things I emphasize to my patients, many of whom are moms or middle-aged guys, is to partner with me. I'm going to help them dramatically with surgery, but if they take it to the next level through increased or improved diet, increased exercise, building some muscle, burning some fat, it supercharges our results, and we all win together. This is a great example of that tummy tuck and what's possible with a superior body contouring technique. This is Dr. David Stoker, board certified plastic surgeon in Los Angeles and body contouring expert.